Patient 46-year-old presents with pain in the epigastrium for 1 month. Now we scan the abdomen. Here we see the duodenum and echogenic lining and gas shadows. Here we see the pancreas, which is echogenic. Here we see the portosplenic conference and splenic vein. The pancreas lies anterior to the splenic vein. The pancreas is echogenic and shows well-defined margin. Anterior to the pancreas, here we see duodenum, where we see echogenic area with shadows. The gas appear as echogenic area in the gut loops. The pancreas appears to be normal. When there is inflammation of pancreas, the epigastrium area is tender and very difficult to scan. The duodenal gas shadows obscuring the body and tail of pancreas. Here we see the gas shadows. When there is inflammation of duodenum wall, we can see the hypoechoic line or hyperechoic line around this gas area. It means there's mild inflammation of duodenum present. Now we scanning the liver. The liver texture is echogenic. It means liver is fatty. The normal texture of liver is always light gray or less echogenic. Now we're scanning the whole liver and find any focal lesion or pathology in the texture of the liver. Here we see the gallbladder, which is partially failed, but the walls of gallbladders are smooth and thin, appears to be normal. We feel no tenderness at this area in the right hypochondrium. Now we see a hypoechoic area at the interior wall of the gallbladder or in the liver texture. It appears as focal lesion in the liver texture. If we see the other texture of liver, which is echogenic, but this focal lesion is hypoechoic. The focal lesion is an oval shape or well defined. Now we measure the size of this lesion. The size of this lesion is 23 into 14.9 millimeter. Now on color Doppler, we see no flow in this lesion. Here we see peripheral flow of this lesion, which may be arterial flow of portal triad or hepatic artery, but no internal flow seen. Now we measure the wall of gallbladder. The thickness of gallbladder wall is 2.4 millimeter. The normal thickness of gallbladder wall is 3 millimeter. Now if we focus the gallbladder, and here we see the cystic duct of gallbladder. This cystic duct join with common bile duct. The focal region of liver is lies anterior to the cystic duct. Now when we focus the cystic duct, we see an outgrowth or echogenic mass at the anterior wall of the cystic duct, causing partial obstruction of cystic duct. Now we will measure the mass in the cystic duct. The size of this mass is 15 into 8.4 millimeter. The focal lesion of liver is also lies adjacent to this cystic duct lesion. Now we scan the common bile duct and portal vein. The portal vein and common bile duct are appears to be normal. Now we measure the common bile duct. The common bile duct measures 4.6 millimeter. The normal size of common bile duct is up to 6 millimeter.
Now how we will write report. The liver is normal in size and shows increased echogenicity. A well-defined hypoechoic lesion measuring size 23 into 15 millimeter present in the left lobe of the liver in the segment 3. On color Doppler, flow is absent. Gallbladder is normal, no stone or mass present. The wall thickness of gallbladder is normal, 2.4 millimeter. The normal size of gallbladder wall is up to 3 millimeter. Another elongated, well-defined echogenic lesion present in the intracholecystic duct, size 15 into 8 millimeter, causing partial obstruction. The ultrasound diagnosis is intracholecystic papillary neoplasm with the focal lesion in the segment 3. The patient is referred to triphasic CT scan for liver.